All right, we'll go ahead and get started. We wanted to give you all an opportunity to log on to the call. So we'll go ahead and get started. Welcome, everyone, to the second edition of the PILS Conversation from Midyear to Match, presented by the Pharmacy Initiative Leaders Organization, otherwise known as PILS. My name is Brian Sackey. I'll be your host for this evening. Currently, I serve as the president and CEO of the PILS organization, but professionally, I work at the South Texas Veterans Affairs healthcare system as a psychiatric pharmacologist. I also actually did a PGY1 and a PGY2 as well. And so with this opportunity, I hope to provide you guys all experiences from me as well as our esteemed guests on the panel. Now, just before I begin, I just want to, for those who may not be too familiar with the Pharmacy Initiative Leaders Organization, I want to provide just a little bit of a background of who we are and what we do. So as stated, we are the Pharmacy Initiative Leaders Organization, otherwise known as PILS. We're a nonprofit 501c3 organization which really seeks to provide resources for aspiring pharmacists, pharmacy enthusiasts. So that just ranges from anywhere from pre-pharmacy to seasoned vets, really anyone who may benefit from some of our services. One big thing about this organization is the community effort by everyone. A lot of selfless acts by many pharmacists, which seeks to really help support, promote, connect, and cultivate a network that really is for the success of you all. So this program tonight really underscores what we truly value, which is helping you guys out, reaching back as much as we can to make sure that everyone is really successful in their individual endeavors. Now, I don't want to belabor you guys too much with the organization. I do want to point out that we are online at www.pilsconnect.com. That's one L. And we are also on social media outlets to include Twitter and Instagram. Both are at PILS Connect, again with one L. And we're also on Facebook. You just simply search Pharmacy Initiative Leaders. And so please feel free to follow us and like us on those outlets. As well as with this particular event tonight, we're going to allow you guys to engage with us through those individual outlets, ask questions that we're going to hopefully try to address later on or throughout this conversation. At the end, we will provide an opportunity for everyone or those who are on the call to go ahead and ask directly live as we're recording this. And just to also mention, this is being recorded, so for those who may not be able to attend tonight, please feel free to share this. It will be available for you all, I believe, on YouTube, so we'll present that information afterwards. And I'm really, really excited to really get started with this. And before I introduce the guest, I want to provide an opportunity for some of the PILS officers to go ahead and introduce themselves who are on the call today.
Good evening, everyone. My name is Josh Blackwell. I'm currently the Chief Executive Chairman for the Pharmacy Initiative Leaders, and also completed a PGY1, PGY2 Masters in Pharmacy Health Administration within the Houston program, so go Cougs. And we are so excited to have you guys here and learn more about not only our organization, but how to obtain a residency. So thanks for having us, and thanks for joining.
Good evening, everybody. I'm Dr. Martine Vernon. I'm also a psychiatric pharmacist with the North Texas VA. I currently work at the Fort Worth Mental Health Outpatient Clinic in Fort Worth, Texas. I did my PGY1 residency. I did an ambulatory care-based residency at the Phoenix VA, and then I completed my psychiatric residency at the Denver VA. So I am also honored to be with you guys this evening, and I'm looking forward to all your questions.
Great, awesome. Now, I actually forgot to mention myself. My PGY1 was done over at the Houston VA, or Michael E. DeBakey VA, and did my second year program at the South Texas VA. So forgot to mention. Oh, and of course, I went to the real HU. So that definitely must be noted, which is Howard. Now, thank you very much. I'm sorry? Okay, sorry. Thank you very much to our officers who are on this call. We'll go ahead and shift this over to our esteemed guests. Very excited to have them on board. Honestly, this is a great opportunity for them to not only share their experiences, but for you guys to engage with them because they've been in your shoes. They probably had the same questions you've had. So we'll talk a little bit about some of the good parts, the bad parts, things that worked, things that didn't work. And, of course, this will be a very informal talk today. As the title suggests, this will be a conversation for you guys. So we hope to provide you guys as much information, but be as casual as we can with this and really be as candid as possible. So we'll go ahead and start with Chantal Houston. And really quick, just a disclaimer. You guys are doctors, and you guys deserve that, hold that to high esteem. However, just to kind of go along with the informality and the casualness of this talk, if it's okay, I'll be calling you guys by your first name. And this is really an effort to not butcher your last names, but I'll be calling everyone by their first name if that's okay. So without further ado, we'll go ahead and start with Chantal.
Hey, good night, everyone. Chantal here. So I am the current PGY1 community-based pharmacy resident at Moose Pharmacy. It's a joint program with the University of North Carolina Eshelman School of Pharmacy. I graduated from the University of South Florida College of Pharmacy in May 2018, so baby pharmacist here. I applied to 4 programs, VCU, UNC, Iowa, and St. Louis. I was really looking for programs with strong independent pharmacies who were well known for clinical programs, and actually interviewed at 9 sites, all independent pharmacies. And I am at Moose Pharmacy now, which is where I really wanted to be with my experience with NCPA, just being exposed to Moose Pharmacy. And in my current role, we do health coaching, transitions of care. We precept a lot of students from a lot of different colleges of pharmacy. I do a lot of community outreach as well, so I have a lot of partnerships developed with some community organizations. My business plan right now is focused on getting the diabetes prevention program started up at Moose Pharmacy, so I'm working on a grant application this week. And my research project is focused on primary non-adherence and intervention to collaborate with providers to reduce the rates of primary non-adherence. Shout out to Pills for having this. I think it's a great conversation to be a part of. So thank you, guys.
So we'll go ahead go to Priyam. And again, I'll just allow you guys to go ahead and introduce yourself and take the platform, really. So Priyam?
Yeah, sounds good. Hey everyone, my name is Priyam. I'm currently a cardiology clinical pharmacy specialist over at the South Texas Veterans Healthcare System in San Antonio. I graduated from the University of Illinois back in 2016 and then did a PGY1 pharmacy residency, followed by a PGY2 cardiology residency at St. Luke's in Houston, Texas. I think I applied to 15 programs when I applied 2 years ago for residency, and I think I interviewed at roughly 13 of those 15 programs. So since I graduated, I have accepted a position over at the South Texas Veterans Healthcare System. I'm one of their clinical pharmacy specialists in cardiology, where I primarily see heart failure patients in the outpatient setting. And then we also help manage other cardiac disease states such as hypertension, AFib, coronary artery disease, stuff like that. And because we do practice under a scope of practice at the VA, it allows me, to prescribe medication by myself, order labs, order imaging modalities such as TTEs, as well as entering consults. And the position really does allow me to practice at the top of my license. And it's been a great experience so far.
Hi, everyone. This is Kaylee here. I am one of the PGY1 community pharmacy residents at the Johns Hopkins Home Care Group. I graduated from the Ernest Mario School of Pharmacy, which is essentially Rutgers Pharmacy up in New Jersey. I was born and raised in New Jersey, I was born and raised in New Jersey, moved down to Baltimore, Maryland for the residency, and I can tell you it's probably one of the best decisions I've made for my career and also for my life as well. So I'm excited to go a little deeper later, but I applied to, I believe it was 6 programs. It was a mix of community pharmacy residency programs as well as the more traditional pharmacy residency programs. I got invited for an interview at 5 of them. I did have to reject 1 because of location, but I did go on site to interview with 4, and then ended up at Johns Hopkins Home Care Group. So.
Hello, everyone. My name is Dozie DK. I am a PGY1 pharmacy resident over at the VA North Texas Healthcare System in Dallas, Texas. I graduated from University of Houston, so go Cougs. And I applied to 10 programs, and I received 5 interviews. Eventually had to turn 1 down from a scheduling conflict. And I early committed for PGY2 in psychiatry. And my current role as a PGY1 involves just participating in inpatient rotations where I'm part of a team providing care to patients. Also, we are required to do outpatient rotations as well, where we see patients in clinic who have a variety of disease states and we manage them. And we're also required to do longitudinal projects. So my research project right now is looking at quetiapine use and hospitalizations in patients with Parkinson's disease psychosis. And I'm currently doing a quality improvement project on patients who need to complete urine drug screens in order to get refills on their controlled substances. Right now I'm on my internal medicine rotation, and I am precepting 2 students.
Hi, everyone. I'm Amanda Sirasingh-Toxin. I graduated from Texas A&M in Kingsville. I did my PGY1 at CHI St. Luke's in Houston, and I'm currently a PGY2 oncology resident at Henry Ford Hospital. I think what's unique about our program is that we have a large outpatient presence. So my project includes a high-risk monitoring program that's pharmacist-led and will measure the impact of a toxicity assessment and interview-based patient follow-up program.
Hello, everyone. My name is Chioma. I am a PGY1 resident at the University of Washington Medicine. I am in a combined program, PGY1 and 2, with a master's in health administration. So I applied to about 10 programs, and then I interviewed at about 7 programs, really all over the country, and really happy ended up where I matched where I ended up. And currently my residency project is to develop or implement a pilot for a meds-to-beds program at our hospital because we currently are not offering that service to our patients. So really excited about kind of leading the way and implementing something new. That's pretty much it.
Great. Thank you very much, panel. I believe that's everyone we have here. Thank you guys so much. Again, we are very, very lucky to have you all. And as you guys can see, we really have an eclectic group on our hands. So we hope to provide you guys a host of information, questions that you guys may have. I'm sure a lot of them have experience or are going through now. So this should be really, really exciting. Now, before I continue, I just want to mention here that though I think this will be really informative for you guys, please be sure to exhaust as much resources as you can. A lot of organizations are doing and providing a lot of great services to include ASHP, SNAFA, APHA, a lot of resources there. We want to just make sure you guys are as prepared as possible through this process. Feel free to talk to your mentors, your faculty, all those who've been through this process to make sure you guys are successful. So we'll go ahead and get started. I'm gonna go ahead and ask a few questions to our panel. First question I want to direct towards Chantal. She is, as she mentioned, it's a PGY1 now, so she may be really privy, or at least this may be fresh in her mind as far as some of the process that she went through in preparation. So, Chantal, what were you doing to prepare exactly 1 week to 2 weeks before your on-site interview?
So I was trying to keep my nerves calm, for one. Just try to be more, just go within and be confident in, myself and my preparation. Try to talk to people to get, just to calm down a bit, because it was a stressful time for sure. But really to feel less stressed is to feel like more prepared. So I was doing mock interviews with some of my professors, plus professors who I knew would give me really good criticism back. We had a set of mock interviews that we were required to do, and the first ones I did, I didn't really get, a lot of feedback. So I scheduled another one with one of my professors who I knew was tough and would give it to me. So I was doing mock interviews. I was researching sites. I was compiling some answers or some prompts to be able to think about interview questions. I was going through different scenarios of, just things that happen maybe in organizations, or how I handled certain situations, just so when interview time came around, I would have ideas of things to pull from. It wasn't really to rehearse answers. It was just to make sure I'm thinking about these different scenarios. Because 4 years of pharmacy school is pretty long, and you forget all the things that you do. So a lot of my preparation was going through and, trying to relive or rethink these scenarios that occurred during pharmacy school, and also help practice answering different questions with family and friends to make sure I didn't say too much, or just to make sure my style during interviews was appropriate.
Thank you. Now, I'm sure you're not the only one that was nervous. I was definitely nervous, especially before my first one. So I definitely can relate to that. Does anyone else on the panel have any insight on sort of what they did to prepare a week before?
I'd say, I don't know if this was a week before, but I had the honor and privilege of having an excellent mentor who's on the call right now, who just really helped me go through kind of your traditional interview questions, and he also went through a similar interview process. So just having someone who has gone through it. So really, I think just the key there, and even if you don't have a mentor per se, but just talking to upperclassmen and just learning a lot about the ins and outs, because I think there's a lot of things about interviewing and even the whole residency process that are not necessarily set in stone and very program specific. So it's really important to talk to people who have really gone through it recently and get their feedback on what your plans are, what your responses are to kind of traditional questions, and even a lot about the culture and whether or not you should say certain things or approach certain questions in a certain way.
Awesome. Sorry, go ahead.
This is Kaylee. I just wanted to say that I was a little bit different. I feel like I wasn't as nervous going into the interviews. I remembered about 2 weeks before, of course, I was preparing. I was looking at the interview questions, making sure that I had certain stories in mind that I could pull and use if needed. But I just remember as I was counting down the days, I got less and less nervous. And I can tell you with Johns Hopkins Home Care Group, that was my first interview, and the day before it was Super Bowl night, so I just watched the Super Bowl the whole night, didn't look at any more interview things at all, and I feel like that really helped with the nerves the next day too, and I honestly think it's so important that you're not nervous going into an interview, because you want the people to see the real you, and I usually like telling all my students that if you go in with nerves, people usually will see that and can tell that you're nervous. So the best way really is to just go in, be yourself, shine like the star that you are, and then people are going to see that if you're able to really sell yourself as you.
Absolutely, absolutely. All very important tips. One big key thing I just want to add here is that, of course, you shouldn't wait 1 to 2 weeks before you pack in all your preparation. That's going to definitely induce anxiety. However, just make sure that anywhere between that period, you are relaxing, taking deep breaths, and really sort of being as optimistic as possible. I'll sort of switch gears here. I know as far as the interview process, several components. Some programs may ask you to prepare for a case. A lot of programs ask you to complete a presentation. Now, Priyam, I know that with you, you've done both the PGY1 and PGY2, specifically one in cardiology. Want to ask, first of all, did you have to complete a presentation at any point during your residency process as far as residency interviews? What was the topic and why?
Yeah, so because I applied to, again, so many programs, different institutions did require me to give a presentation. And for the most part, I kind of kept it the same as I went through different places, just to keep my sanity alive. So I ended up doing my presentation on a non-cardiac disease state. I remember doing it on sickle cell disease because it was something that my heme rotation as a P4 really kind of focused in on. And because I already had that presentation already prepared throughout my rotations, I just felt that I already knew the topic pretty comfortably, and I already had prepared the actual PowerPoint presentation slides. So I wasn't as nervous as preparing a brand new presentation for the residency interview. I know when I went to other programs, I think more so on the West Coast, they also wanted me to do a presentation, but it was more of a different style. So they actually asked me to do a clinical Pearl presentation. And it's only a 7-minute presentation where I just speak about a specific clinical Pearl that I might have picked up on rotation. So that was slightly different compared to the traditional PowerPoint presentation that other programs may have asked of me. So that's kind of one tip that I always recommend to people. I don't necessarily, create a brand new presentation for the residency interview. Some programs, can or do allow certain, allow candidates to use the previous presentation, and for the most part, they wouldn't know if you didn't use a previous presentation. But as long as you look at it, revise it, study it, and you should be good to go.
Very good point. Honestly, don't overwork yourself. Don't do extra work that you don't need to do. Really, as Priyam mentioned, hone in on what you know best and be the master of that when you present it to everyone else. Great. Thank you very much for that. Does anyone have anything quickly to add, any tips about presentation?
Yeah, this is Dozy here. I would agree. I had a case presentation to do for an interview. I did mine on beta blocker toxicity. I, too, did it. It was a previous presentation, and I felt like it was strongest during my 4th year of pharmacy school, and I just kind of fine-tuned it and kind of touched it up to make it even better. But one thing I would say is when preparing for a presentation for any program, you want to sort of tie in the topic of your presentation and why it's relevant to that particular program. I think that's really important, just to kind of so that it's applicable to where you're about to go into.
Yes, very, very much so. Thank you for that.
Mm-hmm.
So we'll now switch gears a little bit more so about the whole interview process, right? So as I mentioned, it's an eclectic group that we have here, and really the flow of the interview can change and vary from person to person or from program to program. I want to ask you, Kaylee, what was the typical flow for the interview that you've had?
Right. So it really, like you said, depends a lot on the program itself. I can say that at my interview with Johns Hopkins, they were definitely more structured, a lot more structured than the rest of my interviews. It was also the longest, so it was a dinner plus almost a full day the next day. I interviewed with probably about 4 groups of preceptors. Also interviewed with the past residents as well. had lunch with preceptors, had dinner with residents. So it was definitely very intense. You had to be like on top of your game the whole day, plus the night before. But at the same time, that's also kind of an advantage for you because you kind of get to see how they interact with each other, how you interact with them. You get more time with them, so you kind of can gauge where you fit in and whether you fit in the program. The other programs that I interviewed with most were just about half a day, so I did feel that at certain parts it felt a little rushed, and I wasn't able to kind of connect with some of the people that I talked to, which was one of my deciding factors of whether I wanted to go to a program or not. And I feel like that even though you're going for the interview, it's also very important for you to kind of take in whether you like them or not, and you're at the same time grading them as well. So just don't forget that.
Very, very good point. Does anyone else have anything to add as far as what you noticed in regards to the flow of the interview?
I would say unless anyone's doing admin, most of those interviews are pretty much an entire day long, so just be prepared for that. It's definitely a marathon. The dinner is still part of your interview, but at the same time, like, definitely feel free to talk about things that are not related to pharmacy, because at the end of the day, you're going to be spending a long time with these people, so you want to be able to make sure you can get along with them as well.
Very good point. And it also good to point out, so I believe that was Shioma who was just talking, and with her doing, no problem. With you doing an admin residency, I'm sure your process is probably different from, say, someone else who's doing maybe community or just straight clinical. You mentioned the dinner, so that's even an interesting piece of it because that's really where a lot of times the interview starts, even though it's in a casual setting, correct?
Yeah. I had a couple that started with a dinner before, but some that ended the dinner the same day. But it really just is variable on the schedules and flights and things like that. But yeah, I think it's a good way to either wrap up the day or set the stage for the day. I think it has its pros and cons, whether or not it starts the interview process or ends it. But, yeah, it's definitely admin-wise. It's usually full day-long interviews, meeting with a lot of different managers and a lot of different, like, clinical preceptors as well, just because they want you to be fully integrated in their health system. So there's a lot of people to kind of touch base with.
Awesome. Thank you very much for that. Anyone else have anything to add about that, about as far as what they noticed on the interview as far as the flow?
I do. This is Amanda. At one of my interviews, it was basically just an open-ended question-asking session where I wasn't interviewed at all, and it was just me asking the questions. So wow. I don't know if this was mentioned before. Yeah, prepare questions to ask the program because you never know if you're going to be driving the interview. And thankfully I had about like 15 to 20 questions that I prepared, but that was something that took me by surprise.
Yeah, definitely. Speaking of taking me by surprise, with the interview, you never know what to expect. And for me, I think what was interesting were the type of questions that varied from site to site. One of the most, unprepared, unable to prepare for questions that I've had during my PGY2 search, one of the programs asked me if you could be any mythical animal, what would you be? And first of all, you have to determine what is a mythical animal. I don't know. I didn't know how to answer that, but I guess they're trying to figure out your imagination, your creativity. Honestly, probably what kind of childhood he had. Again, this is psychiatry, so they're really probably psycho-judging you at that point. But really, really interesting. So I want to open the floor up to the panel. We'll actually start back with Amanda. What were some of the questions that took you by surprise?
think something that not necessarily like took me by surprise, but something I wasn't prepared to answer was like describe a time that you went above and beyond for a specific patient. And I remember not having an answer prepared and thinking later on that I could have given a much better answer. But there was that one, and then also another one that I heard was, what movie or show describes your life? And I think I was stumped by that question too. Because at the time I was watching Game of Thrones, and I was like, that's not something that would describe my life. But yeah, those are some weird ones.
Anyone else?
I didn't go ahead. Oh, sorry. This is Kaylee. I just had one. It was more so of a clinical question, which is why it kind of stood out. It was actually a really hard clinical question, and they basically asked me, and gave me this disease state where I had no idea what it really was, gave me 2 antibiotics, and was like, oh, which one would you choose? And at that time, I was totally stumped, did not know whatever they were talking about or the difference between the 2 antibiotics or which one should be the right answer. So I was honest. I was just like, that is a good question. I don't know the answer to that on the top of my head. But then I followed up with, I can do some research and I will get back to you. So that's exactly what I did. I did a follow-up email afterwards, kind of going through the thought process, finally answer the question. In the end, though, I don't think I necessarily had the right answer, but because they were looking for something very specific. But then they did reply and told me the right answer and appreciated that I followed up. So part of me wants to say that the reason why they asked that question was to see how the candidates would respond in a situation like this, because I doubt that they expected everybody to know what those 2 antibiotics are, the differences between them, that disease, et cetera. So they're trying to be tricky, so you just got to be careful.
Yeah, that's a really good point, Kaylee. It's okay, ladies and gentlemen, to say, I'm not sure, I don't know. They don't expect you to know everything, which is the point of a residency, to help you get to that point, or not know everything, but, get more knowledge in some of the various areas. One key thing you want to make sure you do is if you don't know, definitely follow up with the program. When you say I will get back to you, it's really sort of highlighting your integrity and your ability to actually follow through. So very good point. Any other questions by the panel that you found to be surprising?
Go
ahead.
This is Chioma. Oh, I'm so sorry. You got next.
Okay.
But for me, it wasn't an unexpected question, but I just had one interviewer who, similar to someone earlier who was speaking on, they just had an open-ended chat, I guess, and I had one that was similar. It wasn't necessarily expecting me to ask questions, but they were just let's just talk about leadership, or we just had a conversation during our interview time. So I think, long story short, I would say really be prepared to be well versed in what's going on in pharmacy, what's going on in if you're applying in psychiatry, things like that, because you might just have just open-ended conversations about some subject area within where the program you're applying to. And if you just aren't up to date on what's going on in your field, I think it'll stand out. So if you know you're applying to a pediatric program and you can't just have a casual conversation about patients you've treated in the past or some new study that's really all the rave, it may not be the best reflection. So look through your journal briefs, read the news, all those things.
Very good point. Okay, I know someone else is trying to talk. Okay, go ahead.
This is Dozy. I had one interesting question on an interview. It was, if you had an anniversary dinner tonight, but if you had a major project due the next day that still needed work on, what would you do? Now, obviously, that's a time management question, which is kind of what I prepared for, but what caught me by surprise was the specific scenario they gave me. So for those out there, just kind of be prepared for, unique scenarios that typically come from typical and general questions.
Yes, very, very true. Almost kind of like that mythical animal question. Again,
Yeah.
still stunned by that. Thank you very much. So I'll sort of switch gears. And I mentioned earlier that some programs will ask you to complete or present a case, sort of almost kind of tying back to the topic on presentation. I want to ask you, throw it back to you, Dozy. How would you, I guess, your recommendation of how you should best prepare for a clinical case that an institution may provide?
I've heard some students and residents say that, they typically don't prepare, or they do, some don't. I know for me, especially if I had the time, I would just review common disease states, the major ones, CHF, CAP, HAP, diabetes, just to give yourself a kind of like a good refresher if you haven't looked at those in a while. But at the same time, I would take that with a grain of salt, because I've seen some cases that are kind of out there where they'll ask you C. diff or meningitis. I even got one in hypertriglyceridemia. Yeah, I would say if you have the time, just kind of skim through those major disease states, because you might be likely to see them.
Yeah, it's very, very important.
This is Kaylee. I also just wanted to say I totally agree. I think it's worth the time just reviewing at least the general guidelines of certain big disease states, just because they are likely to ask for more general information. But also keep in mind the program that you're applying to, because for me, because I applied to mostly community pharmacy residency programs, I knew that it's likely that they're not going to ask me about something like sepsis or HAP, things like that. So I generally focused on like the bigger chronic disease states like hypertension, diabetes, hyperlipidemia, things like that. So I think know your audience is pretty important here and can save you time.
Yes, absolutely. Absolutely. I think Chioma was also mentioned as far as being up to date on some of the current meds, things like that. You never know what sort of information may be provided or presented that they may expect you to be up to date on. So that should help. Thank you. I want to quickly. Sure.
So kind of going back to the case situation. So I also think it would be a good idea to kind of become familiarized on how to structure a SOAP note. So you know what goes into each section. So, subjective, objective, A, and P. And then I know it depends on the program, but did you give you like a piece of paper, to actually write down your SOAP note in? Try to write down as much as you possibly can, because even though you might not know the right answer, they still might want to know your thought process, or any other bits and pieces that you might know about a specific disease state or whatever it may be. So I think that might also be a good idea.
Yeah, very, very key. That's pretty much going to be the format that they expect you to follow. So thank you for that, Priya. It's very, very key. Now, we do have a question from the feed that I just want to ask the panel really quickly. So someone asked, what advice can you provide on what to do within your first 90 days of residency? Now, of course, we're assuming that we're sure that everyone on this call is going to get their residency. So after they matched, what would you guys provide as far as some advice on what to do within your first 90 days of this residency? Well, you can start with Chantal, because I know you're, again, PGY1. This may be fresh for you. So what would you say?
I would say for my first 90 days, it was definitely a huge learning curve and trying to get licensed. There's a lot going on. But I would definitely say focus on the relationships with the people that you are with. I know with me being in the community pharmacy, the technicians have been there for way, way longer than I had been. So I really focused on getting to know them as people, and also, having them, really leaning on them to help me get accustomed to, pharmacy operations and workflow processes. Just showing people, I think, that you care first instead of, just always going to them to help you with something. It definitely makes a difference with how you're received, because you're going to be a pharmacist. You're going to be coming in, taking the lead. So you definitely want that respect, and I think showing that you care goes a long way.
Yes, absolutely. Befriend everyone. You'll be working with everyone, honestly. So that's a very, very good point. We also have another question from the feed. So this person asks, for those who have the VA, do you feel like the questions were more STAR-based, performance-based, or more clinical questions? So I know we have Dozy at the VA, so we can go ahead and kick it off to you to ask or provide any advice on that.
Sure. You said STAR-based, clinical-based, or?
Performance-based questions.
What was that?
The performance-based questions almost like provide a scenario where you had to tell your teammate that they suck, things like that, how you responded.
I would say it's more so a combination of the STAR-based and the situation performance-based. For the VAs I interviewed at, they kind of save the clinical stuff for the case presentation and also the case that you have to complete. But I would say there's a good amount of STAR questions and scenario questions as well. And the best way to just kind of prepare for them is to just kind of think back, to your experiences in your life, your professional life before a year, and kind of just, think of the stories, the situations where you could have, made a great intervention, things like that, help someone in need, things like that. So I would say just kind of prepare for those questions.
Absolutely. I would agree. I'm at the VA, I did my residency at the VA as well, and I do remember it really is a combination of all three, honestly. VA is very, notorious for having performance-based questions, even when you're applying for a job there. So being familiar with that is very important. I think a lot of other institutions are incorporating that because they want to see your ability to work in certain environments. So definitely good point. We have another question here, more of a general, but how do you stand out in an interview? If there's one thing that I guess you try to incorporate during your process to make you stand out, I'll hand this off over to Chioma.
I think one of the ways I tried to stand out, at least for me, I don't know that I thought about it so particularly, but I think that one of the things for me, I just tried to be honest and genuine because I think, you are the only individual like yourself. And I thought I was very introspective about why I wanted to do this. So I feel like that really came through in a lot of my responses to certain questions. And I think because I was very introspective, not just throughout my interview process, but really throughout pharmacy school, I really had thought out responses for many of the situations I had been in, many of the experiences that I had taken on. So I think that really provided me with really good responses for a lot of different questions. And then I think one thing I will say that maybe made me stand out a little bit more than some of the other applicants is I had a really great experience with a chief pharmacy officer that I did a rotation with. So I also got a letter from her, but because she was fairly well known, it was a good conversation piece. So I think for me, you really just have to think about why you're doing this. It might be a little bit late for most of us, so why you're doing this, and as you go through your rotations, things like that. It'll really make you have more thorough, non-generic things to say when people ask kind of the typical interview questions.
Yeah, very, very important. Anyone else have anything to add as far as what they used to stand out?
This is Kaylee. I feel like for me, I tend to keep things very kind of lighthearted. I don't like to keep things too serious. So a lot of the times during my interviews, when they ask me about any questions, of course, sometimes I would have questions about the program itself, but I usually like to ask them a question about them. So I like to ask what they like to do for fun or what brought them here, things like that, to kind of get to know them as people. And I think that helps really a lot because you obviously are going to spend a long time, as you know, with these people. So it's important to know if they're people that you would enjoy working around. And I can distinctly remember that actually one program I can tell really, really like that because in one of my interview sessions with them, actually it was with the director, and he began by asking a lot of more clinical questions / behavioral questions, but then he did this kind of thing where it was back and forth. So he would ask one question and I would ask one question, and all of my questions were pretty much oh, what did you like to do for fun? What kind of food do you like things like that. And then in the end, he was he just smiled and laughed and was just well, you know what, this, I don't know why I'm asking you all these clinical questions because obviously everybody's qualified to be here. Everybody has impressive CVs. So he started asking me questions about my personality, what I like to do for fun. So it ended up being a great conversation. I learned a lot about him as an individual. And I think that's so important. And it really, if I were interviewing people, that person would stand out to me versus someone who did a bunch of stuff, great CV, things like that. But the only thing that I would also add is you have to know the person or you have to kind of gauge the person that you're talking to too. So if you're cracking jokes, but no one's laughing, or the opposite side isn't really responding, you also have to know when to back off. Pretty much.
Yeah.
That's important as well.
Absolutely. One thing I just want to, highlight with both these responses is that really being yourself is going to help you stand out as much as possible. Now, there was another question that was related to that from the feed, related to really how do you go about the dinners? Because some institutions will invite you for a dinner, and sort of what experience with this. So I would definitely say, definitely eat. I've been in situations where candidates were not eating. You can hear their stomach growling during the interview. It's very uncomfortable. You're a human being. So if you're invited to a dinner, they expect you to eat. And it just kind of goes along the same lines as being yourself. So that honestly would be my number one advice. Eat, be normal, communicate. Of course, try as much as you can to be as etiquette as possible, not be sloppy, but for sure, definitely be as normal as you can. There was another question by the feed where they were asking, well, how do you really assess the culture of the program that you interview? I'll pass this on over to Chioma. Now, you're doing admin, so I think for you probably had different avenues. Is there any quick thing that you use to help assess the culture of the program?
Yeah, I think it really goes back to, that was the first question I asked everyone pretty much when they opened up questions for me. But I also think a lot of times, people have their prepared response that they're going to give you. So I think it also kind of goes back to your gut feeling and intuition as well as their response. And they might say, oh yeah, we're very supportive here. And then you look around at some other residents that may not be in your interview and they look like they're not having a great time. So really looking for that discordance because it may exist. And then also talking to people kind of offline. So if you know any previous residents or have mentors and colleagues that know previous residents, I think that's really your best way. And then any other, even just pharmacists that you know from work, et cetera, because they might have peers and colleagues that have either went to that institution or heard about it. You hear a little, maybe too often, that, pharmacy is small. So more than likely, you know somebody who has touched or been around that institution. so they can also give you an idea of what that culture is like outside of whatever response they might give you. But I do recommend definitely just asking people, seeing what they say, but also comparing what they say to what you kind of feel and what you kind of hear from other individuals.
Absolutely, absolutely. Now, I want to ask a very important question, I think, which really helps the listeners now to really get a good grasp of what to do and what to expect. So knowing what you know now, what do you wish you had known or did prior to or during your on-site interview? We'll go ahead and start with Kaylee. And I hope everyone can provide some quick insight on this. I know I don't know if you need a little bit of time to think, but I know for me, I don't think I was myself enough in certain interviews, but as the interviews went on, I was able to sort of organically present who I was. And I think they really appreciated that, again, because you are an individual. So trying as hard as you can not to, impersonate someone else, to not be who you are. And they really would appreciate that. But so, yes, I'll go ahead and start with Kaylee.
Yeah, I feel like in terms of interviews, I had mentors that told me, like, be yourself, things like that, but I feel like I never truly understood it until I was in the moment, because I feel like it's one thing to say it, like you can always be like, yep, just be yourself, it's going to be fine, you're not going to be nervous, but once you're actually in the moment, it does get nerve-wracking, and it's normal to feel nervous, so don't think that you're the only one that's nervous in that room, because I'm sure same thing's happening to that other candidate that's interviewing with you, the same day as you. So I don't think that should be the focus of your interview, though. I think in order for you to shine, you will have to overcome that, and whether it may not be at the first interview that you have, but with each interview, it's practice. You're going to get better. So don't be too discouraged if your first interview doesn't go as well as you planned or thought it would, because chances are everybody probably bombed their first interview, and it's something that you can probably laugh at later on anyway. But one other thing I probably would also mention is this is more specific towards my residency, but I actually never took into consideration of having co-residents, and now being in the program, I absolutely love having co-residents, so I wish that I had taken into consideration at that time, and I feel like if I didn't have co-residents right now, I would not be enjoying the program as much as I did before. So that's just one thing that I noticed while being in the program.
Very, very good point. Thank you. Does anyone else have anything to add?
I'll say one thing, and you guys maybe hate me a little bit focusing on admin so much, but long story short, I would say just networking with your co-interviewees, just because, they're all going to match somewhere amazing. And so you never know when you might need to call in a favor, or even if just next year at Midyear, through all the hustle and bustle of talking to all these different people, it's nice to see certain faces and say, hey, how's it going? Where'd you end up? And just checking in with different people. So as much as it is, definitely a stressful process, and that is your competition, at the end of the day, it is going to be about fit. And so you are all going to match at somewhere amazing that fits for you, and they're all going to match at somewhere that fits for them. So just talk to the people who are kind of going through it with you, and don't necessarily give them the cold shoulder just because you guys are all fighting for the same one or two spots. Yeah.
Very, very important. Well, one thing I want to add to that is also one thing I wish I hadn't done for a few of the programs was I was definitely creeping out and trying to look up the individuals who will be interviewing with me. I don't think this is a good idea, honestly, because you're putting pressure on yourself again. This goes back to being who you are. So even if you know who else is going to be interviewing with you, sometimes we send a list out of the candidates on your particular day. Don't look them up on LinkedIn. I think that just adds unnecessary pressure, and it's kind of creepy. So we should all just avoid that. Anyone else?
I have one thing to add for the what would you do in the first 90 days of residency. I would say, like, hopefully for most of you guys, you have like an orientation period. So I would say use that to the best of your ability, try and get licensed before you start residency. And if you don't, like, take that test sooner rather than later, especially with NAPLEX. Like, NAPLEX seems like the biggest, overwhelming test in the world, and it really is not. So just get those exams out of the way so you can take time to relax as much as you can. I mean, definitely as you start up residency, there's a lot that goes into that in terms of just moving and getting settled. But a little related to what someone else was saying earlier, I think it'll go a lot further for you if you spend that time getting to know your co-residents, getting to know technicians, pharmacists, and all the other individuals that you'll be working with, rather than, stressing about licensing or just stressing about being this exceptional resident because you want recommenders for PGY2 or something like that, and you're overachieving and beyond. Like, make sure you are also building relationships with all the people around you, and even just getting some rest and some time for yourself, because it will be a long year, and you'll know that in the next 2 months.
Yes, absolutely. Now, we are near the end of our time. I just want to be respectful to the panelists. We did say 8 o'clock. So I do want to take this time to, first of all, again, thank the panelists. You guys have been more than amazing this evening in providing all your insights, the do's, the don'ts, what worked, what didn't work, and so forth. So definitely just want to take this time to thank them. I know there's still